Welcome to The Real News. I'm Kim Brown. COVID-19, the coronavirus, it's all anyone can talk about, and for good reason. As of Thursday, there were at least 1,200 reported cases of infection across 44 states here in the U.S., with 37 deaths. But what phase are we at for this pandemic? And more importantly, with over 30 million Americans lacking health insurance, how will that impact the spread of this virus and ultimately how many people die? To get more answers and to get some more information about this, we're joined on the line today with Dr. Dennis Parada. He is a retired Texas state epidemiologist, and he's joining us today from Smithville, Texas. Dr. Parada, thank you so much for being here.
It's my pleasure. Thanks for asking me, Nan.
So, Dr. Parada, you're down in Texas, which has the largest number of uninsured persons in the country, 5 million. And we're going to delve into the consequences of that. But first, let's look at Texas in the micro, because some of the issues that public health officials are dealing with there are similar issues that other state health agencies are either currently dealing with or they will be dealing with very soon. So, as reported by the Texas Tribune on Wednesday, the largest public health lab in the state currently is only able to accommodate 26 coronavirus tests per day. And Republican Governor Greg Abbott says he hopes to ramp up that capacity to 125 tests per day. So, relative to what you are seeing, is this an adequate rate of testing?
Well, it's really important for public health to get a sense of where the infections are occurring and how many. Just knowing that is a basic public health tool to tell us that we're doing better or we're doing worse. Without testing, the nature of this virus and the disease that it causes is sort of vague. It's not. It's sort of like a cold or the flu. It's sort of non-specific signs and symptoms, with the exception of a fever. And so it's really hard to first determine how many of these cases are occurring without good laboratory testing. And so we've been sort of at the mercy of the CDC and their abilities to prepare these test kits and get them out into the field. And so in Texas, we have an excellent state health laboratory, has a long history of being able to do some of the frontline new things that are happening. And but we can't do them with a test that we made up ourselves. It has to be testing that's been approved and established by CDC. So we were waiting for those to happen. Now they seem, and it is happening, but certainly not at the rate that anybody really wants to see.
Dr. Anthony Fauci, who was the director of the National Institute of Allergy and Infectious Diseases, he said on Wednesday that the coronavirus, COVID-19, is 10 times more deadly than the seasonal flu. Let's have a listen to what he said.
We will see more cases and things will get worse than they are right now. How much worse we'll get will depend on our ability to do two things: to contain the influx of people who are infected coming from the outside, and the ability to contain and mitigate within our own country. Bottom line, it's going to get worse.
Dr. Parada, in your opinion, is what Dr. Fauci is predicting, is he giving us the worst case scenario, or is this pretty accurate relative to the number of infections versus the mortality rate?
It is not, in my opinion, the worst case scenario at all. Dr. Fauci is well known for bringing balanced, science-based facts and opinions together and using them to instruct and inform. So what he says is, and I agree with him, is what we would expect to see with a great deal of confidence.
The first reported case here in the US of coronavirus infection happened at the end of January, and it was reported in Washington state from someone who had been traveling abroad. And I know you're in Texas, and the Texas Tribune and the Houston Chronicle have reported about a man who has confirmed a positive COVID-19 test, I believe in Montgomery County. I think that's outside of Houston, and please correct me if I'm wrong there. But health officials believe that he contracted coronavirus via community spread. Can you tell us about in the phase or in the life of a pandemic or an outbreak, so to speak, when we reach the community spread point, where are we at?
We are in the beginnings. First of all, you are correct, and that was Montgomery County, and that is just north of Harris County, which is the Houston metropolitan area. The length of time that it takes to identify that first case, all of that time that goes on, there's a possibility that there is some spread within the community, hence the term community spread. Up until then, we've been able to find possible exposures to the cases that occurred coming from outside of the U.S. And so the idea is that if you cannot identify where this person got his or her infection, then we are possibly thinking about that the infection is occurring within the realm of the United States or the state of Washington or the areas around Seattle, which of course means that it is at the doorstep of either going to a full-blown epidemic within the U.S. Or not. And we're right at that level that what we still need is better testing to help us get those answers ahead of time and not waiting for people to get ill.
Doctor, unless you lived through the Spanish flu pandemic over 100 years ago, all of us are in uncharted territory here. And some medical professionals have spoken about flattening the curve. Can you explain to us what that means?
Sure. If you can imagine that there's going to be a certain number of cases of this condition, whether it's the 1918-19 flu or coronavirus, if you can spread those cases out, that is to slow the epidemic from getting overheated, if you will, you can allow our hospitals and healthcare facilities more time to take care of the cases that they have. Whereas if you have all of those happening at once in an uncontrolled person-to-person spread epidemic, then you are going to quickly overrun, oututilize, and severely diminish the healthcare system that needs to take care of all these people. So it basically means instead of all of the cases occurring at once, which will overrun and diminish the effectiveness of our healthcare system, you have these cases being slowed down and occurring at a rate that the hospitals can take care of them.
On Thursday, the Chinese government declared victory over COVID-19 with approximately a dozen or so new cases being reported in Wuhan province, which is, of course, ground zero for the virus outbreak, which happened about 3 months ago. If this is true, if what the Chinese government claims is accurate, in your opinion, firstly, what did they do wrong? And conversely, what have they done right?
Well, it's hard to know exactly what's going on in China. We get various reports of various accuracy and a lot of questions still had. So I'm reluctant to suggest that I know what they've done well or not done well, but they have mobilized a great large number of testing events in their country, as have other countries. And they've been able to get a better picture of what's going on in their communities and in their nation than perhaps we would with our minimum testing that we've done. I don't know what to make of that, and I'm taking a wait and see and observe. I think people are hoping that, well, if they can do it, then it's going to be no problem for us to do it. And I think it's just too early to say right now.
President Trump addressed the nation Wednesday night from the White House, and he said that he is working with insurance companies and Medicare and Medicaid to eliminate copays for testing and other costs associated with treating COVID-19. Let's have a listen.
Earlier this week, I met with the leaders of health insurance industry who have agreed to waive all co-payments for coronavirus treatments, extend insurance coverage to these treatments, and to prevent surprise medical billing. We are cutting massive amounts of red tape to make antiviral therapies available in record time. To ensure that working Americans impacted by the virus can stay home without fear of financial hardship, I will soon be taking emergency action, which is unprecedented, to provide financial relief. This will be targeted for workers who are ill, quarantined, or caring for others due to coronavirus.
Though the details of the president's proposal has not been confirmed, and House Speaker Nancy Pelosi said on Thursday that they were still working to iron out the details, one thing he said erroneously was that anyone who wants to be tested for coronavirus can get tested. We know that this is not true. And I wanted to ask, because there are so many Americans, 5 million alone in your state of Texas, over 30 million nationwide, who don't have access to health care, and conversely don't have access without cost to testing at this point in time. How is the state of our healthcare system possibly going to impact the spread of this virus and the number of people who could potentially die?
Well, there's a variety of pressures that make the epidemic grow when it shouldn't grow because of the way that we have divvied out our medical care, our health care here in this country. The president's report was a bit short on details, and so I don't know exactly how they're going to move forward. But I was hoping that there would be some information, some guidance from the public health point of view from the president last night, and talking about how we can transition from the beginning detection part of the outbreak to more of a mitigation, where we have ways of getting the message across and helping communities put together the necessary action plans and make those action plans work, so that we can lower the impact of the outbreak on the medical care system. So I'm not sure that I'm in any better situation than I was a couple of nights ago, I'm hoping that we get more clarification in the near future.
Dr. Parada, in your opinion, as a resident of these United States, as someone who is in their community, who is potentially could be affected, as we all could, by the community spread of the COVID-19 virus, how would you have handled the federal response differently to this outbreak? As of January 21st, that was the first reported case here in the US. And here we are, just some 37 deaths later, not to minimize that number at all. But we have 1,200 infections. Are we doing a good job of containing this, or is the jury still out on that?
I think the jury's still out on that. There's the impact of the problems that we face with the testing kits, what I guess I would call the disparaging or the confusing messages that have been spread about this organism and the disease that it causes from the CDC, which give consistent, high-quality information when it's available, and to others who have come up with their own stories and their own agendas, I guess, and put out confusing and erroneous and inconsistent information. Now, I think we have a huge job in preparing messages that are based on facts and based on the best public health, and getting those out in place of the rather poor communication systems that we've used.
Okay, well, we're going to leave the conversation there. We've been speaking with Dr. Dennis Parada. He is a retired Texas state epidemiologist, and we've been discussing the federal and local response to the COVID-19 coronavirus pandemic, as it has been designated by the World Health Organization. Dr. Parada, we appreciate your time and your expertise today. Thank you so much.
Thanks for bringing us together.
And thank you for watching the Real News Network.